Hello. If you'd just like to take a seat in the folding chair in front of you, please. Let me just pop my gloves on. Tell me how things are. How are you? Good. And almost equally as important, how are the teeth? Okay. Tell me about that. Is it causing any discomfort? No, okay, good. So it's just a checkup. Alright. Since we haven't seen you in a little while, what I'll do is I'll have a look around, bottom and upper sets, and I think the last time you were here, let me just check. Yeah, we charted your teeth last time you were here, and I think maybe you went out of the country for a while. Yeah, we recommend them every 6 months. So if it's been a year since you've been here, so I'll have a little look around, see if there's anything to see besides teeth. And I think what we'll do then is we'll actually take a x-ray of the teeth. Okay, all that will involve is a liquid being applied to the teeth. It's more like a gel, and we'll cover your eyes, take a few pictures, and from there I think maybe I'll get your teeth properly flossed and cleaned. And if we have time, I actually have these new whitening strips that maybe we'll place over here. Yeah, what we call the aesthetic teeth. Sure. Sound good? If you have any questions throughout any of the operations, just let me know. It's everything we're doing today is always is non-invasive. There'll be no pain, no drills, nothing scary. Alright? And even if we were, which we're not, even if we were to be doing any of these things, I would be here talking you through step by step, and everything would be completely painless. Okay? Alright, get comfortable. Just gonna pop my mask on. I hope you can still hear me through this. All good. Fantastic. Now, of course, we use a fresh set of utensils every time. And all we'll be using is the mirror and the scaler. Okay. This is our mirror. Surprisingly, guess what that does? The scaler. Some people can be a little bit intimidated by scalers, but needless to say, they're actually not really that sharp at all. They're just for, there's no point to them, they're completely blunt. All the scaler will do, if we see any particular discoloration or any trapped food, we can just slide it away, okay? Again, there'll be no pain, so relax. What you might hear quite frequently is a, okay? Nothing to worry about. Any questions? Good. If you can just pop your mouth open for me. If you need to swallow or take a breath or any kind at some point, just let me know and we can break for as long as necessary. Alright. Okay, just pop your mouth open for me, please. Okay, we're gonna start at the lower left, right at the back. And we'll start looking if you have any in your wisdom teeth. Okay. A little bit of discoloration. Okay. Good. Good. Just a little bit of food. Did you brush before you came to see me? Do you know when I was a kid, Mom always made me brush just moments before seeing my dentist. And I used to say to her, if I've cleaned my teeth properly, why am I cleaning them before I see the dentist? Isn't that the dentist's job? Of course I brushed them anyway. Okay. Alright. All I'm doing here is just having a look at each tooth. And the mirror allows us for full rotation of the tooth. Good. Good. Now we're just working our way to the front. If you could just try and pin your tongue down for me, please. Thank you. I appreciate it can be difficult. Good. You're doing very well. We've almost finished with the bottom set. We have a slight discoloration. But nothing we can't fix today. Good. Good. Okay. Okay. The wisdom teeth, hereditary. If you know this, have you had any issue with them coming through? Have they kind of come through impacted in your mother or your father, perhaps? Okay. Occasionally, genetics can have a little bit of an influence on how the teeth come through. But ask in cleaning them correctly. Sometimes you can clean and floss and have parents with perfect teeth, and things can still go awry, but nothing untoward. So you have a slight discoloration on your front line here, but they look fine. I'm just going to pop up to the upper. Again, open nice and wide for me, please. The top teeth can always, even with 10 years experience, they can be a little challenging to get to. And I want to make sure I have a proper, clear and unobstructed view just relax. We won't be too much longer. We're just now coming round to the front again. Your incisors, the top row, are noticeably whiter than everything else in the top line. Now, that isn't unheard of. I've seen it before, but it's have you been using any kind of teeth whitening before? Okay, I see. Yeah. No, it's okay. That's fine. It's not a problem. We can fix that. Okay. Sometimes when people are using, especially the trays for the teeth whitening, you'll find that your incisors are quite prominent, and in some cases, when they're making the initial mold, the incisors are almost a little bit too bold, and they're accentuating. So then a lot of the peroxide sits on these two front incisors. But again, it's not something that we can't address for you, okay? We're almost done here. Just working our way down the back. There we go. Just bear with me for one moment. Okay. My apologies. My desk fan popped on. Or the AC unit, rather. It'll be shutting off soon. Okay. There we go. Good. So we're almost done. Still on those back molars. They're looking fantastic. Okay, good. I appreciate that might have taken a bit longer than you would have liked, but I like to get a proper evaluation of the teeth, and with that in mind, I said I would like to x-ray the teeth. Now all we're going to do for this is just take a unopened syringe, and there'll be a liquid that I'll be, no needle by the way, just the plastic end of the syringe, and I'll be just lathering the teeth with a liquid that just makes the x-ray a bit more clear. It's almost like a dye, but it's completely clear to the human eye. Okay, good. Just bear with me just for but one moment. There we go. So it's a very thick mixture. And I'm just going to work my way around each of the teeth, just covering it quite liberally with a little bit of this fluid, okay? Just if you can open your mouth wide, please. Now it is quite sticky, but it's quite sweet. Surprisingly. There we go. I'm just going to get right to the roof of the mouth here. You can smell it. I'll ask you to try and keep your mouth still just for a moment, please. I'm sorry. There we go. Good. 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 Right to the front teeth. And I'm trying not to dribble anything down the front of your mouth. I'm sorry. There we go. You can hear it's just air bubbles. Don't worry. Okay. And just the back teeth. There we go. And that's us covered. I appreciate you can't speak. Okay. Now all that's going to happen, we'll cover your eyes and I'll step out of the room, pop the x-ray machine on, and it's just going to take a couple of quick x-rays. We'll have these developed and we'll have you back your next appointment and we'll have a proper look at the x-rays together. Taking the x-rays is more of a long-term preventative. Absolutely. Okay, just close your eyes and I'll pop out the room for you. Okay, perfect. Okay. How was that? I'm just going to give you a drink of water just to swallow your mouth out. You can feel free to, you don't have to swallow, but you can just kind of let it out in the sink. Or you can swallow it's just water and the liquid and the exactly. It's not harmful in any way. And it does actually taste quite nice. There you go. Just rinse. Gargle a little bit. I said you can spit it into the sink or just you can swallow it. It's harmless. Just so it's easier for you to talk again, right? Very good. Okay. Now, so we'll get the x-rays developed and on your next visit we'll go through them and I'll talk you through them and exactly what it is that they're showing us. Okay? Good. Now, the next thing I'd like to take you through is showing you how to brush properly and floss. And brushing, I would recommend an electric toothbrush, if I'm honest. You don't have to. Conventional toothbrush like this, absolutely fine, no issue. Just make sure you are thorough with it, okay? When you're brushing the teeth, you have to be sure to get behind the corner. A lot of people brush their teeth like this. So the front of the tooth looks sparkly and bright and very, very clean. But it's behind the tooth that you see caries, and depending on your pronunciation, you'll see tartar and plaque building up. And it's that can eat away the tooth. Alright, so be sure that when you're cleaning, here. You're also here. And here. And if you can, flip the toothbrush over to the back and give the back of that tooth a proper scrub. Okay? And you have a group of teeth like this. Front. Underneath them. The side. And all the way around the back. Okay? Flip that toothbrush over and go around the back of them. Okay? It's imperative that you do that. You'll be looking to clean each tooth for 15 to 20 seconds. Okay? Or you can get them in groups of 3. Try and spend at least 10 seconds on each tooth. It doesn't take long. It's about 3.5 minutes. It's not a huge amount of time. Alright? Good. Now, a lot of people struggle with flossing. They might find that the thread can get stuck between the teeth, or that they can't get between the teeth. And wrapping a piece of floss around your fingers, it's not easy to maneuver. Alright? I know that. I share the same problems. So what I actually buy, these are called dental floss picks. And I actually find that these are far easier to work with. They look a little bit like, well, guitars almost, but I'll use this one on myself. What's nice about these is that they have a hard plastic bottom, and you can actually bite down on the thread and get it between the teeth, and then just pull it back out very, very easily. And you can do this with just moving and working your way back, then just flip it over and do the lower side. It's very, very easy to do, and it's comprehensive. It really forces the wire between the teeth, gets those bits of food that the toothbrush just simply cannot reach. Okay? It behooves you to floss. I encourage flossing every single day. As a dentist, I meant to say after every meal, realistically, just before you go to bed. Your teeth will thank you for it. I can't guarantee, but it drastically reduces the need for any kind of root canal, any fillings, because the food just isn't there to start rotting away the tooth. That's all this is. It's just preventative. Everyone likes a nice smile, and very few people. Nobody likes having a filling. Alright? Not to mention they're expensive. Prevention, much better than cure. Okay? So I'm gonna pick out a new one. And I'm just gonna go around each tooth for you, okay? So I'll clean them first, and then we'll floss. Always clean, then floss. I'll get you a new toothbrush. And all we're going to be using is a very simple whitening paste. It's non-peroxide, but it's really quite effective. Okay. Okay, and I just teeth together. Perfect. Now I'm just gonna open your mouth wide, please. Teeth together. brushing these teeth. Starting the lower set. Really getting in behind each and every tooth. Good. Good. A lot of people will come to me and say that when they're brushing their teeth, they go to spit the toothpaste out, and they're seeing blood, and they panic. This almost always isn't anything untoward. It's usually just a piece of food has become trapped between the teeth, and the toothbrush just can't get to it. And over time, bacteria get to this piece of food, and it's actually yeah, exactly. And when the toothbrush gets to the gum's irritated now that it's inflamed, and it bleeds very, very easily. So it's almost always just a piece of trapped food. It can be the beginning of what we call gum disease. But again, if you're seeing blood when you spit out your toothpaste, just see your doctor. And by doctor I mean dentist, because I am actually a doctor. I'm reminded, I actually have a GP, general practitioner, friend of mine who I play squash with. He takes great delight in reminding me that I'm not a real doctor. And I go to great delight reminding him he's not a real player. Exactly. We play squash, tennis. We actually play Overwatch together in Hearthstone. I'm a much better Hearthstone player than he is. I appreciate this is a very strange conversation. Okay, I'm just going to pull up to the top set. There we go. How are you doing? Good. Now I mentioned about the slightly whiter incisors. And what we're going to do when we apply the whitening strips that I'll talk you through after. We'll actually skip the incisors. I'll just remove the paste from that portion of the strip, allowing to brighten everything else by a couple of shades. Good. We're almost done. I appreciate this may have been the longest teeth cleaning you've ever experienced. Service with a smile. Good. Alright. Okay, I'm just going to give you a glass of water. Rinse and spit, please. Okay, just in the sink. Okay, just mouth open, teeth together for me, please. It's looking much cleaner. Alright, now I'm just going to floss very quickly between each tooth, and then we will apply the whitening strips. Okay? Okay. Again, open up please, this time nice and wide, and no biting down. actually bite down. And all you'll be doing, as I said, is forcing this part between the teeth. You're using this as like a bridge support. So I'll line it up. This is teamwork. I'll line the tooth and the string. Okay, and now bite down. Easy. That's just, again, it's just forcing the floss between the teeth. Removing any food. Good. Next tooth. Bite together. Very good. And again. Again, we're just removing those food particles. And bite down, please. And again. And again, please. Yeah, there's a bit of crowding there at the front of the teeth. But again, nothing to worry about. Bite down, please. And again. And again. And there's no blood coming from any of your gums, so even though you haven't really been flossing, you've been quite lucky to this point. But any longer, and some of these food particles would start to break down. And together again, please. And one more. Good. Now I'm just going to do the upper. Bite together, please. And this time, remember, it's coming from the bottom. Good. And again. Good. And again. Occasionally you feel like it's stuck, but it's not. You can just pull on the handle and it will always pull clear. Yeah. It's just pull it and it'll pull clear. And again. Good. And again. Again. You're doing very, very well. Again. Just need to pull the gum a little bit. Perfect. Bite together. Good. And bite together again, please. Last one. Well done. Okay. How are you doing? You've been exemplary so far. So all we have to do now is just apply the whitening strips. And I'll actually talk you through them. Okay. Now, these were actually taken into our practice by one of my colleagues, Dr. Sophie Michel. And these are included in your checkup. They are a natural alternative to the peroxide whitening that these home help kits that you might have seen online. We obviously offer a peroxide whitening ourselves in clinic. I'm not a huge fan, I'm not a huge believer in bleaching the teeth. While what we use is as enamel safe as peroxide could ever possibly be, it's still not something I openly encourage. These are a natural whitener. They have no peroxide, and essentially they're two strips, one along the top teeth and one along the bottom. They actually have quite a nice coconut flavour to them, and they won't have the intensity of the pearly white of a heavy concentrated peroxide solution. But what it does offer is a much more gentle but still very effective natural whitening. Okay? So I will pop two strips on for you. And these are fairly inexpensive. Some there. I'm a huge advocate of these. Very, very simple. Look just like this. This is for the bottom set. This is for the top set of teeth. Okay. Open wide. I'm just going to place the top strip on first. I just fold the flap under the bottom of the teeth. And I'll do the bottom. Together again, please. I'm just folding that flap over the top of the bottom teeth. Good. Now you can just sit here they should be left on for about 30 minutes. Okay. In this instance, we'll leave them on for about 10 minutes. I'm going to go and tidy everything up, write up my charts, and we'll come back and we'll have the strips taken off you, okay? Perfect. Okay, let's get those strips off. Open your mouth, please. And the bottom strip. Okay, I'll give you again another drink of water to smell your mouth out. And again, you can swallow it's like a coconut almost paste, a coconut flavored kind of oily paste. Some people find it unpleasant and just spit it out. Some people actually like the taste and flavor and will swallow it, okay? Yeah. Take your glass away, thank you. Okay. We are done for the session. How did you find it? With a map. Very clever. We like to be as comprehensive as we possibly can be, right down to the whitening strips that we offer on our own cost, essentially. We like to offer a premium service, and we take customer satisfaction and our patients' satisfaction to the utmost. It's paramount to us, to me, to the receptionist, and to every other colleague we have working here. Okay? If you ever have any issues with your teeth, any whatsoever, please don't be afraid to pick up the phone and give us a call. I understand there is a huge stigma attached, even now with dentistry, and pain, and that unease. People I've seen pass out with panic attacks, anxiety over coming to see a dentist. We aren't bad at all. We want to see you better. We want to help you. And if your current dentist doesn't make you feel like they have your best interest at heart, they have your well-being, find a new dentist. Because the vast majority, if not all dentists, at their heart, care and want the best for their patients. I know I certainly do, and will continue to fight. And I will nag and moan sometimes that maybe you're not cleaning as often as I would like. But we do this, again, with your intentions, with your best interests at heart. Alright? We don't want to cause anyone any discomfort. We don't want to be doing anything more than just the checkup. Alright? But you have to help us. Good. It's been an absolute pleasure today. And again, just see the receptionist on the way out, and we'll get you booked in 6 months' time. If you have any questions, sure. I'll remember for next time. Thank you very much, and see you soon.